What happens if you have a patient rinse with an alcohol-based mouth rinse, and then it occurs to you that they're in recovery for alcoholism?
Find out today on Medical History Mysteries.
Hey, everybody, we are continuing our coverage of dental professionals are humans too. And this topic this week is alcohol recovery. Now, we know we're supposed to avoid any alcohol contained products, rinses, etc. But what if you accidentally gave them a mouth rinse that contained alcohol? What do you do then?
So, again, this is going to go back to a lot of the points we made in previous episodes. How do I know this patient's a recovering alcoholic? I don't know that unless they tell me. Well, will the patient tell me? Maybe they will and maybe they won't. I mean, to some folks, it's a stigma and they don't want to admit it out loud. And to some folks, they don't feel it's your right to know. I don't want to just say it out loud because it's a part of my past I want to put behind me, or it's none of your business. And in some states, in some municipalities, it's even protected by law. You're not allowed to ask unless they offer you the information first. So, with all that being said, all you can do is rely on the medical history. You put everything you can in that medical history to make sure you're asking all the right questions. Let's say the patient doesn't tell you that they're a recovering alcoholic, and you give them an alcohol-based rinse, okay, and they rinse with it. That might be enough to completely capsize their recovery. But if you didn't know, how could you possibly make that determination in advance? You couldn't. So that's an omission in the medical history that, again, you're putting everything on the medical history. You're asking the right questions on the medical history. Again, make sure, as we said earlier, that the person who's taking the medical history, you have confidence in. You've done a few sessions with them. You've taught them, and trained them to take a medical history and know how to ask the right questions, and don't check no, 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 no in all the boxes until you've actually asked the questions. Those kinds of things. What if the patient does admit to you that they are recovering from alcoholism? Now what? Well, you give them the rinse that contains alcohol and you realize you may have capsized their recovery. So that is always going to be a call to maybe their physician or whoever's handling their case for alcoholism, the person that works with them, and make them realize, okay, this is what happened, and we regret the mistake, and what can we do going forward? What kind of advice can we give to your patient as far as steps going forward? Realize, though, another wrinkle or ripple in this is that patients who are recovering from alcoholism sometimes take medications to prevent them from using alcohol. So a drug like disulfiram is a drug that patients who are recovering from alcoholism take because if they did try alcohol, it would make them nauseous and want to vomit. Okay, so they're doing their end of the bargain, right? They're taking this medication every day. They're not consuming alcohol. You give them a rinse that contains alcohol, and now they get this severe nausea and severe vomiting. That's another thing you don't want to happen as well. And that's why it's important maybe to avoid all alcohol-based mouth rinses as it is, because we kind of know this in dentistry. Alcohol isn't the best thing because it's a drying agent and because it can have other issues, and maybe avoid it altogether. That's what I would do if I'm going to use something in my office. I would try to make it alcohol free so I don't have to worry about this. What the patient does, what they use on their time is their business. But I would not, I would consider using an alcohol-based rinse in my office probably not the best idea.
Sometimes it's hard, and it happens to all of us, where there's a lot of companies that are really generous, and sometimes they'll send you samples, and you don't want to let them go to waste. So sometimes you'll just use them as a breath freshening agent, or maybe you might use it as like a pre-rinse or something like that, or you might, which I've seen before, using a mouth rinse that you put into the ultrasonic to clean night guards and retainers and things like that to kind of freshen them up, or dentures. And so certainly it's worth having set protocols on the products that you're using in your practice. If you might even accidentally give away a sample of an alcohol-based mouth rinse. So definitely always read the ingredients of the products that you're going to dispense and use in your practice, but it's also worth having set protocols so that hopefully you can just avoid that.
It's all about the relationship too, Pam. As you said before in a previous episode, it's important to have a relationship with your pharmacist. It's important relationship with your referring medical doctors and other dental professionals. Yeah, it's important to have that relationship with the pharmacist because maybe, if you have a doubt in your mind and you've got that relationship with a pharmacist, maybe you can give that pharmacist a call and find out some more information if you had doubt, if there was a question. And maybe you'd call the medical doctor, or maybe you'd call your referring dental professional. But here, I think the most important thing is to have that relationship with the patient. Say, look, you can tell me anything. I'm not going to spread the word. You do what you do. I don't really want to know what you do, but I have to know because everything you do can affect whatever it is I'm going to be using on you today. And so I don't want to cause you harm. You can tell me anything. It stays between us, okay? And it will never exit this conversation. And having that trust, having that confidence means the patient will be willing to open up to you and say things they wouldn't say to anybody else. Knowing full well that the word's not going to spread means a lot. And I'll tell you what's interesting is sometimes you'll say something to you're a patient, you say something to your dental professional, your hygienist or your dentist, and then the next time you come in, they mention it. That's good. That means, hey, you actually care. Maybe you read my history, you know all about me. But what sometimes erodes the relationship is, let's say you're the hygienist, you know about my previous alcoholism, you mentioned it, and then the dentist walks in and says, hey, I just want to ask you about how things are going with your alcoholism. Yikes. Because now, in my mind, you've not only told the dentist, you've told everybody. So it's important to tell the whole office, look, word's going to spread, people talk, I get it. But when the patient walks in, it's of the utmost importance to maintain that confidentiality and to, sort of choose your words carefully so you don't erode that very precious confidence that's going to make or break our relationship as to whether or not I tell you more about me or not.
Yeah, and once trust is broken, I don't know. I don't really think there's too much you can do to come back from that. So that's really, really great advice. So I hope everybody heard that and maybe even rewind and re-listen because that's a big deal. I also think that you said this in a previous episode about being an investigator. The patient might not disclose that they're in recovery, but they might disclose the medications that they're taking. And so we are human. We don't know every single medication that exists. Gosh, there's so many medications that are out there. We don't have them all memorized. You might, but I certainly don't. And we have to look them up or ask the patient, why are you taking it? And so that might create a dialogue or allow you to know a little bit more about the medical history in a deeper way by inquiring about those medications. So I think this was tremendous advice. And, we are all human and we all make mistakes, but it's nice to know what to do if something happens, because unfortunately, we're not always perfect 100% of the time.
To your point, man, very well said. Let me give our audience two drugs they should be looking for, okay? So the one oral medication that a lot of people take if they're in alcohol recovery is disulfiram. You can look it up. The brand name is Antabuse. It's been around for decades. But again, this drug makes you nauseous if you use alcohol, so there's no incentive to use alcohol. Another drug that they can use is Vivitrol, which is an injectable drug. And that again also curbs cravings for alcohol. And so with those two drugs, you can find out a lot about the patient, and that way you can even start the conversation. Then again, if you know about those medications, maybe the conversation never has to happen. Maybe you know enough about them to say, hey, let's not include alcohol-based mouth rinses. Take this away. Give me the other stuff that's not alcohol-based. And then it never has to be an issue or a conversation or a problem.
And it's also an opportunity for education for your patient. They may not realize that the mouth rinse that they just grab off the shelf at the local pharmacy may contain alcohol and might be giving them a lot of complications that they're not aware of. So it's great information for us, but great education for our patients. So with that, Thank you for that information. And everybody, we can't wait to see you all next week where we're continuing the conversation of dental professionals are humans too.
See you, everybody.